Dear participants, in this lecture, I am going to discuss about trigeminal nerve, its course and significance. I am going to cover this particular topic under these following headings: Introduction, trigeminal nucleus, the trigeminal nerve, course, branches and distribution, and finally, definition of pain, pain pathway and theories of pain. Well, trigeminal nerve is fifth cranial nerve, which is mixed in nature, and it is composed of a small motor root and a considerably large sensory root. The motor root supplies the muscle of mastication and other muscles in the region, whereas sensory root supplies the skin of the entire face, the mucous membrane of the cranial viscera and oral cavity, as well as the maxillary and mandibular teeth. There are 4 nuclei related with trigeminal nerve. Out of 4, 3 are sensory and 1 motor. The sensory nuclei include primary sensory nucleus, which is located in lateral part of pons. The spinal sensory nucleus, which is a long nucleus. It extends from the caudal end of the primary sensory nucleus and it extends till cervical segment 2nd and 3rd. The mesencephalic nucleus, it is located in midbrain on either side of aqueduct of Sylvius. The primary sensory nucleus receives general sensation like touch, vibration, pressure, etc. Spinal sensory nucleus receives pain and temperature, whereas mesencephalic nucleus receives sensations related to proprioception. Single motor nucleus, it is located on both the sides, again in the lateral part of pons, but on the medial side of the primary sensory nucleus. This is a pictorial image of the trigeminal nerve, its relation with the nuclei and all the 3 peripheral branches, namely ophthalmic, maxillary and mandibular division. The motor root originates from motor nucleus within the pons. It runs entirely separate from the large sensory root. It leaves the cranial cavity along with the mandibular division of the sensory root, passing through the foramen ovale. After coming out of the foramen ovale, the joint sensory and motor root are known as mandibular trunk. The motor branch of the trigeminal nerve supply the following muscles: the muscle of mastications like masseter, temporalis, medial pterygoid and lateral pterygoid, the myloid muscle, anterior belly of digastric, tensor tympani and tensor belli palati muscles. The sensory root, these fibers constitute the central processes of the ganglion cells located in the trigeminal ganglion, or other name for this ganglion are semilunar ganglion or Gasserian ganglion. This ganglion is located in the Meckel's cavity on anterior surface of the petrous portion of the temporal bone. This ganglia is flat, crescent in shape and has 3 sensory divisions. These are the peripheral branches of the trigeminal nerve, namely the ophthalmic, maxillary and mandibular division. The ophthalmic division is purely sensory and it is the smallest of the 3 divisions. This leaves the cranial cavity and it enters the orbit through the superior orbital fissure. It supplies the eyeball, the conjunctiva, the lacrimal gland, parts of the mucous membrane of the nose and paranasal sinuses, and also the skin of the forehead, eyelid and nose. There are 3 branches of the ophthalmic division: the frontal, the largest one, nasociliary and the lacrimal. The nasociliary nerve travels along the medial border of the orbital roof, giving off branches to the nasal cavity and ending in the skin at the root of nose. The branches of the nasociliary nerve are divided into the branches given within the orbit, branches given in the nasal cavity and terminal branches on the face. The branches in the orbit are long root of sensory ciliary ganglion, long ciliary nerve, anterior and posterior ethmoidal nerve, and these nerves supply the iris, cornea, ethmoids, sphenoid sinuses, skin over the tip and L of nose. The branches given in the nasal cavity supply the mucous membrane of the nose. and terminal branches on face provide sensory supply to the skin of the medial part of the eyelid and side of nose. The frontal nerve is the largest and divides into supratrochlear and supraorbital nerve. The supratrochlear nerve supplies the conjunctiva and skin of the medial aspect of the upper eyelid and the skin over the lower and the medial aspect of the forehead. The supraorbital nerve is sensory to the upper eyelid, the scalp as far as back as the parietal bone and lambdoidal suture. The lacrimal nerve is the smallest and supplies the lateral part of the upper eyelid and a small adjacent area of the skin. The autonomic ganglion, which is associated with the ophthalmic division, is ciliary ganglion, which is suspended within the orbit via this particular nerve. The maxillary division is purely sensory and it arises from the middle of the trigeminal ganglion. The maxillary division leaves the cranial cavity via foramen rotundum and it comes into the pterygopalatine fossa. From pterygopalatine fossa, it enters the orbit via inferior orbital fissure. Within the orbit, it runs within the floor of orbit in the inferior orbital groove and canal. And finally, it comes out on the face via infraorbital foramen. The branches of the maxillary divisions are given from the different part of nerve lying at different locations. Number 1, the branches given from the part of nerve lying within the cranium. Number 2, branches given from the part of nerve lying within the pterygopalatine fossa. Number 3, the branches from the part of nerve lying within the infraorbital canal and groove. And finally, the terminal branches of this nerve on the face. Firstly, the branches given from the part of nerve lying within the cranial cavity. These branches are middle meningeal nerves which travel with the middle meningeal artery to provide sensory innervation to the dura mater. The part of nerve lying within the pterygopalatine fossa gives off 3 branches: the zygomatic nerve, the pterygopalatine nerve, and the posterior superior alveolar nerve. The zygomatic nerve is further divided into zygomaticotemporal and zygomaticofacial nerve. Zygomaticotemporal nerve supplies sensory innervation to the skin on the side of the forehead, whereas zygomaticofacial nerve supply the skin on the prominence of cheek. The pterygopalatine nerve are further subdivided into orbital branches, nasal branches, palatine branches, and pharyngeal branches. The orbital branches supply the periosteum of the orbit. Nasal branches supply the mucous membrane of the superior and middle concha and also the lining of the posterior ethmoidal sinuses and posterior portion of the nasal septum. Whereas palatine branches include greater palatine nerve and lesser palatine nerve. The greater palatine nerve supply the mucoperiosteum of the palate of that side up till the premolar canine area. The pharyngeal branches supply the mucous membrane of nasal part of the pharynx. The posterior superior alveolar nerve descends from the main trunk just before the maxillary division enters the infraorbital canal via inferior orbital fissure. It passes through the pterygopalatine fossa and they reach the posterior surface of maxilla, from where this nerve enters the maxilla via different alveolar foramina which are present onto the posterior or infratemporal surface of maxilla. This nerve supply the molars of that region, the first molar, second molar and third molar, except the mesobuccal root of the first molar. The branches given from the part of nerve lying within the infraorbital groove and canal are middle superior alveolar nerve and anterior superior alveolar nerve. Middle superior alveolar nerve supplies the premolars and mesobuccal root of the first molar, whereas anterior superior nerve supply the central incisor, lateral incisor and canine of that side. Finally, the terminal branches on the face coming out of the infraorbital foramen. These terminal branches are inferior palpebral, which supply the lower eyelid, external or lateral nasal that supply the lateral part of the nose, and superior labial that supply the upper lip of that side. The autonomic ganglion associated with the maxillary division is the sphenopalatine ganglion, and it sends secretomotor fibers to the lacrimal gland, nose and paranasal sinuses, palate and pharynx. This is the complete course of the maxillary divisions and several branches from the part of nerve lying at different locations. The mandibular division is mixed in nature. It is largest of the three divisions. It has got a large sensory root and a smaller motor root. The sensory root of mandibular division originate at the inferior angle of the trigeminal ganglion, whereas the motor root arises in the motor cells located in the pons and medulla oblongata. The mandibular division comes out of the cranial cavity via foramen ovale. The main trunk, after coming out of the foramen ovale, remains undivided for only 2 to 3 millimeters. Then it splits into a small anterior and large posterior division. The branches from the mandibular divisions can be studied as follows: branches from undivided nerve, branches for anterior division, and branches from posterior divisions. Now, branches from undivided nerve, it is known as nervus spinosus or meningeal branch. Meningeal branch or nervus spinosus re-enter the cranium through the foramen spinosum along with the middle meningeal artery to supply dura mater and mastoidea cells. Another branch which is given from the undivided nerve is nerve to medial pterygoid, which is motor to the medial pterygoid muscle. It also gives off a small branch. Those are motor to the tensor veli palati and tensor tympani muscles. Branches from the anterior divisions are significantly smaller than the branches from the posterior divisions. The branches from the anterior division, it run forward under the lateral pterygoid muscle for a short distance. Then it reaches the external surface of the lateral pterygoid muscle by passing between the two heads of this particular muscle. From this point of, it is known as buccal nerve. The several branches from the anterior divisions are 4 in number. Out of 4, 3 are motor and 1 is sensory in nature. The motor branches are deep temporal, masseter and lateral pterygoid nerves, whereas buccal nerve is purely sensory and it provides sensory innervation to the skin and mucous membrane of cheek, mucous membrane of mucobuccal fold and buccal gingiva of mandibular molar. Now, branches from the posterior division. The posterior division of mandibular nerve is primarily sensory with a small motor component. It descends for a short distance downward and medial to the lateral pterygoid muscle, at which point it branches into auriculotemporal nerve, lingual nerve and inferior alveolar nerve. Auriculotemporal nerve gets off parotid branches, articular branches, meatal branches and terminal branches. Parotid branches are sensory, secretory and motor to the parotid gland. Articular branches are sensory to the posterior part of the TMJ. Meatal branches supply the skin and meatus and tympanic membrane. The terminal branches supply the scalp over the temporal region. The lingual nerve, it runs downward anteromedial to the inferior alveolar nerve. It reaches the site of the base of tongue slightly below and behind the mandibular third molar. Here it is very superficial and it is maybe seen just below the mucosa. It further proceeds anteriorly, looping downward and medial to the Waters duct to the deep surface of the sublingual gland, where it gives its terminal branches. The lingual nerve supplies sensory innervation to the anterior 2/3 of the tongue, mucosa of the floor of mouth, mucosa and gingiva on the lingual aspect of the mandible. The inferior alveolar nerve is the largest branch of the mandibular division. It descends medial to the lateral pterygoid muscle and lateral posterior to the lingual nerve. in between the sphenomandibular ligament and medial surface of mandible. It enters the mandibular canal at the level of mandibular foramen. The inferior nerve alveolar nerve branches into mylohyoid nerve, mental nerve, and incisive nerve. The mylohyoid nerve is branched just before the inferior ulnar nerve enters the mandibular foramen. This particular nerve is motor to the mylohyoid muscle and to the anterior belly of digastric. It is sensory to the skin of the chin, and it may provide sensory innervation to the mandibular incisors and also the pulpar innervation of the mandibular molar. The mental nerve is sensory to the skin of the chin and lower lip, and also to the mucosa of the lower lip, labial vestibule, labial gingiva, anterior to the mental foramina. The mylohyoid nerve branches from the inferior alveolar nerve before the entry of the letter into the mandibular canal. It runs downward and forward in the mylohyoid groove on the medial side of the ramus along the body of mandible to reach the mylohyoid muscle. The mylohyoid is a mixed nerve being motor to the mylohyoid muscle and anterior belly of digastric. The inferior alveolar nerve divides into its two terminal branches. The incisive nerve forms a nerve plexus that innervates the pulpal tissue of the mandibular first premolar, canine, and incisors via dental branches, whereas mental nerve exits the canal through the mental foramen and divides into three branches. Those innervate the skin of the chin and skin and mucosa of the lower lip of that side. There are certain anatomical aberrations as well. Bifid inferior alveolar nerve and mandibular canal have been observed radiographically by Langles et al. And they have got clinical significance in local anesthesia, particularly difficulty in achieving adequate anesthesia by conventional technique. The autonomic ganglion associated with mandibular divisions are two in number. Number 1, otic ganglion. Number 2, submandibular ganglion. The otic ganglion is topographically related to mandibular nerve, but it is functionally related to glossopharyngeal nerve, and it relays secretomotor fibers to the parotid gland. The submandibular ganglion is topographically related to lingual nerve, but functionally related to chorda tympani nerve, and it also relays secretomotor fiber to the submandibular and sublingual salivary glands. This diagram shows the complete peripheral branches, the courses, and area of supply of the trigeminal nerve. Finally, coming out on the pain pathway and the definition. By definition, as per Monim's local anesthesia and pain control in dental office, pain is an unpleasant emotional experience usually initiated by a noxious stimulus transmitted over a specialized neural network to the central nervous system, where it is interpreted as such. The pain receptors are known as nociceptors, and these are nothing but free nerve endings. The pain fibers are of two types, A delta fibers and C fibers. A delta fibers are thicker in diameter, whereas C delta fibers are thinner in diameter. Velocity of conduction is faster in A delta fibers as per the rule, the velocity of conduction is directly proportional to the diameter of the nerve fiber. So A delta fibers carry pain at a faster conduction rate, whereas C fiber can carry pain with a slower conduction rate. That is why pain carried by A delta fibers is known as first pain or fast pain, whereas pain carried by C fibers are known as slow pain or second pain. The pain pathway, it is simplified pain pathway pictorial diagram for the trigeminal nerve area and its distribution. The pain stimulus from all the peripheral branches of the trigeminal nerve, namely ophthalmic, maxillary, and mandibular division. This pain is carried through these nerves to the trigeminal ganglion area. From the ganglion area, single sensory route enters the lateral part of pons, where it divides in ascending and descending division. Pain fiber follow the descending division, which is known as spinal tract fiber of trigeminal nerve. These pain fiber reach the lower end of the spinal sensory nucleus near cervical segment C2 or C3 level, and first order neuron terminates here. Second order neuron start from here. It will cross the midline and ascend upward, and it will reach the thalamus. In particular, thalamus posteroventral nucleus area of thalamus. So this second order neuron, which is starting from the spinal sensory nucleus and reaching the thalamus area, forms a spinothalamic tract. Finally, the third order neuron will start from the thalamus and it terminates in the cerebral cortex, particularly posterocentral convolution of the cerebral cortex. That is the ultimate area of the pain perception. This is comparison of the pain pathway for trigeminal system and pain pathway in general. In general, if you look at the pain pathway, the various peripheral sensory nerve conduct the pain. The first order neuron will terminate in the dorsal horn, whereas the first order neuron in trigeminal system was terminating in the lower end of the spinal sensory nucleus. Rest of all is similar. Next order neuron, second order neuron will start from the dorsal horn and it will ascend upward to the thalamus, and finally from thalamus the third order neuron will start and terminate in the cerebral cortex. So these are subtle difference between the pain pathway of the trigeminal system and pain pathway in general. There are various theories proposed regarding the pain. The oldest one is the specificity theory. This was proposed by Descartes in 1644. Descartes said that there are certain specific straight through channel from the peripheral side to the central nervous system, and these carry pain. Later, this theory was discarded as there are certain nerves rather than a specific straight through channel, and there are certain synapses and connection between different level of nerve fibers. Those carry pain. Second theory in number, which was proposed by Goldscheder in 1894, was pattern theory. Goldscheder said that pain is not a separate entity, rather when summation or addition of more than one impulses at a particular site cross a threshold value, then only it will evoke a new pattern of impulse which is responsible for pain. But soon this theory was discarded as the pain is a separate entity. Finally, gate control theory was proposed by Melzack and Wall in 1965, and it was the most accepted theory. It has got three components. Number one, pain is transmitted to central nervous system by small peripheral nerves like A delta and C fibers, which we have discussed already. The cell bodies of these fibers, that is A delta and C fibers, are located within the spinal cord, dorsal horn for pain pathway in general, or spinal sensory nucleus for pain pathway for trigeminal system. And these cell bodies can be facilitated or inhibited by large peripheral nerve. Those carry touch, pressure and vibration, etc. Finally, third point is descending control system that descend down from the higher centers. This can control and modulate excitabilities of these cells within the spinal cord level or the spinal sensory nucleus. Now, the gate control theory also says that how this gate closes when intentional stimulation of other large diameter fibers takes place, when at the same time pain stimulus is carried by the A delta and C fibers. The pictorial diagram is very well depicts the phenomena here. The pain is carried by the smaller diameter fibers like A delta and C fibers, and touch, vibration, pressure is carried by A beta, which is thicker diameter, and this also run close to the dorsal horn, but it does not relay in the dorsal horn, rather it straightway go up to the higher center for perception of these sensations, that is pressure, vibration, etc. Now, when a pain sensation is being transmitted to the small diameter fiber, and at the same time pressure vibration is also transmitted from the similar side. Since the velocity of conduction in the thicker diameter fibers are faster, this sensation will reach the dorsal horn at a faster rate. Now, at this point, this will give a collateral to the synapse of the pain pathway, which will block the neurotransmitter release from first order neuron of the pain fiber, and hence this will close the central progression of the pain impulse. In technical language, we can say that intentional stimulation of thicker diameter fiber will impose presynaptic inhibition on thinner diameter fiber, and ultimately this will close the gate to the central progression of pain impulse. These are the references for this particular lecture. Thank you so much.